So that way you can see Stephanie, see Drea. You know
Recording started.
Okay.
So you
All
want
right.
to go through?
Yeah. Hi guys, I'm Jessica with BCID.
I'm Jose Hernandez from United Spinal Association. You want to go
Today
through the ground rules?
No, I'm going to introduce Drea first. Today we have Andrea Dalzell, the seated nurse, and we also have our lovely ASL interpreter, Stephanie. A couple of the housekeeping rules are we have everybody muted, so you're unable to unmute yourself. So at the end, if you have any questions, you can go ahead and raise your hand visually for the people we can see, or use the raise your hand feature, or put a message in the chat box.
And yep, so you covered it. Drea.
Yes.
Introduction.
Introduction?
Yeah, of course.
Andrea Dalzell, I met you what?
Dalzell.
A bunch of years ago, probably at the rowing?
Roll.
No, it was at the water skiing.
Water skiing.
We met at the water skiing event?
I think that was the first time I met you.
You were just telling me that the other day.
Yeah, because we went through past the row house.
I met you before that, but
Even before that?
you can say the rowing or the row house if you wish.
But Andrea Dalzell, sorry, I keep saying it wrong. Andrea Dalzell was 2015 Miss Wheelchair, New York, 2015. She's been a great advocate, has gone on the role on Capitol Hill, and now is the seated nurse. So, what would be the first question we would want to ask her?
Who do you love more, me or Jose? No.
Oh, you
Okay, so I did get a question from one of my coworkers, and her name is Veronica, and she wants to know, you know what? I'm not gonna go in that order because it's not like in fitting order. So let's go to the beginning, and how about what made you want to become a nurse?
So I never wanted to become a nurse. That was not my forte when I was in school. At first, I thought that I was going to become a doctor. And even before becoming a doctor, I thought that I was going to become a lawyer. And I said I was going to go back and sue all the doctors that ever caused anyone with a disability any pain. Like, they were going to go on the chop block because they're doctors and they're supposed to figure out how to make us not be in pain and not live in pain. And that didn't seem like a feasible idea anymore out of high school. So becoming a doctor and trying to figure out how to control one's pain or how to control having your disability and getting around life with it needed to be my forte. And within auditing medical school classes, I realized that doctors treat a disease and they don't treat a person. And I don't want to look at someone as though they're a disease process. I don't want to see Jessica, but see osteogenesis imperfecta. I want to see Jessica, right? I want to be able to treat you how you are in front of me, not your disease process. And I realized that nurses really take on the holistic role of caring for patients that present to them. So that's where nursing and the love of nursing was born within trying to audit classes and deciding that I was going to go that route.
You know, a lot of us here know how it is to be in a hospital and like have that. It is. I always call it my second home, unfortunately, because I spend so much time there, and I hate being seen as a chart and not a person, as Jessica.
Mm-hmm.
It's definitely when you go into the hospitals, it's so impersonal. It's one of the reasons why I refuse to almost stay in a hospital at all. Like, even if I have surgery, if it's not that bad, I'm going home. Because I had a bad experience where I got out of a surgery and they threw me on a bed and let me lay there for 2 hours without checking up on me.
Yeah.
Monica asked, could you ask her to tell her story?
So everyone knows I'm Andrea. I'm from Brooklyn, New York. I was born and raised here. I have transverse myelitis. I was diagnosed at the age of 5 years old. I stopped walking completely at the age of 12. And I'm considered a T10 to L1 incomplete paraplegic. I have some feeling in my legs, but I don't have any muscle movement, and I cannot stand or walk, and I use a wheelchair full time.
She does fabulously. Um, so, did you face any challenges? And if so, how did you overcome them when on your journey of becoming a nurse?
So I think we all face challenges regardless if we're trying to pursue our passion or not. This world was not made for people with disabilities, whether you are in a seated position like I am, or you have hearing impairments, or you have mental impairments, whichever it is, we all face challenges. So in dealing with that alone, yes, I've faced every obstacle you can possibly think of. There's steps everywhere. So yes, I face those. But in terms of going to nursing school, I did not apply to a school that required having a prior interview. My school required just grades to be able to get in. You have to have a certain requirement, and then you have to be competitive. So the best grades get a seat versus mediocre grades not getting into the program, because my program was extremely competitive. So getting into nursing school, no issues. It's actually staying in nursing school where all the obstacles came about, because nurses are not used to seeing people with disabilities trying to come into the profession. So I was automatically told, oh, I don't think that you can be a part of the program. The first day I went in for a mandatory orientation, I was told that I can leave because they were unsure how I would be able to be a part of the program, because I couldn't stand. I was considered a liability. I would be an infection risk. They just didn't know where I would fit in. I stayed and I became a nurse. So, ha.
Cool.
So we have a question from Jacques.
Jacques?
It says, I'm sure that where you work is not totally accessible. What is the major limitation on your nursing practice?
So I honestly don't have any limitations. I use a very small rigid frame wheelchair, so I'm able to get into small areas. I think the only thing that I've ever faced while on the floor was an IV pole that I couldn't bring lower, so I just tipped it over so that I can hang an IV bag. Otherwise than that, I really haven't faced too many obstacles with me working anywhere.
You know, I think that's something with people with disabilities try their best to adapt to, right? Like you just said that with the IV pole, that's how I turn on my light.
Right.
It's on a long thing, so I tip it over and I flick the switch and stand it back up, right? So it's just kind of how you put those different skills to use. I tell people, you know, it's not like, yeah, my legs aren't strong, my legs can't do what your regular person's legs can do, but my hands are my legs and they do everything else just the same way like everybody else. So.
Right. As wheelchair users, we're innovators. We are constantly thinking on our feet. Even as a person who's not using a wheelchair, if you have any type of disability, you're automatically thinking 20 steps ahead of how things are going to get done to your own ability. So we already have an innate instinct to figure out how to get things done versus someone who is able and doesn't have to worry about a physical limitation or a hearing limitation or whatever it is that they're dealing with. Then they're not going to understand that innate ability to be innovative.
Yeah, we definitely have a greater imagination for things too, because it all connects together.
Right.
Oh, so I was gonna say, Veronica, my coworker, she wanted to know, with your clinical like internships and stuff, what was, oh, I don't want to not say it right. yeah, what were your struggles, if any, during your clinical internship?
I think that the biggest part of nursing, whether it was clinical or in the classroom setting, it was really just trying to be a student and not have to worry about my disability. So my disability was made the issue from all of my professors, whether it was in the clinical setting or in the classroom setting. That was the issue. So I wasn't allowed to just be a student. I wasn't allowed to just study the nursing program, study the practice that I was going into. I always had to study and think about my disability and think about the clinical setting and think about what the teacher's going to tell me and think about what nurse managers are going to think about me and what nurses are going to say about me on the floor and what patients are going to be dealing with and how I'm going to turn that bed over in 15 seconds because of the fact that I have another patient coming to the floor, or how am I going to get all those medications into the room without dropping them, right? Like, there was never just a thought process to be the student. It was a thought process about so many other things. And nursing school itself is hard work. Like, it is mentally taxing work that you are learning because you have a person's life in your hands. That's what you're learning to do. You're learning to be a healthcare provider. And when you don't have the option to just be a student, it becomes extremely stressful because you never know when the ball is going to drop or where you're going to make a mistake. And you can't afford to make a mistake because then you're out of the program, let alone the fact I have a disability and all eyes are already on me.
Wow, yeah.
You know something? You said something interesting to me one time. That no one thought that you was gonna give CPR or
Yeah.
be able to give CPR. Um, tell the folks here, how would you, in the case that you told me, a person is experiencing respiratory or cardiac arrest, how would you go about giving someone CPR in a bed?
So I took up boxing to be able to build my upper body strength. Now, I was already strong, but boxing helped me create the stamina that is needed for CPR. Even an able-bodied nurse or doctor or healthcare professional will get winded doing CPR. That is not an easy task, okay? Even strong bodybuilder-like people are winded doing CPR. So I took up boxing to be able to do it. And the thing is, when you're doing CPR in a hospital, those beds get low. And for us, it's just, I have to lock in place. I'm not worried about my knees. I'm not worried about my feet misplacing. I'm not worried about slipping. I'm locked in place, and I just have to worry about my upper body strength. I just have to make sure that I'm far enough over the bed that I'm getting a good level with the patient and being able to do those chest compressions. So what I do is I just pull them close to the edge of the bed and get to work. Like, just like how any other nurse would set up the bed to be able to perform CPR, just set the bed so that I'm able to do it.
I remember one time you mentioned to me, and it's not verbatim, but it was something along the lines of, one time if they're on the floor, I'll get on the floor and I'll give them CPR. I'm not worried about getting up at that time. I'm worried about saving their life. Or I'll get in the bed with that person. It's I need to do what I need to do for them. I'm gonna do it. I was like,
Right.
damn right.
Right. If they're on the floor, what is the nurse doing who's standing up? She's getting on her knees and she's getting to work. If I need to get on the floor, I have that ability to get to the floor within a second. Again, as a wheelchair user, I'm super innovative. And would it be an inconvenience to my life? Maybe. But I think the person who's dying is in a bigger inconvenience than I am.
100%. And I know because, Jacques, I see your question, but I'm to kind of get into your question, I'm gonna follow it up, start it with, I know Dre because I know you personally. You had troubles finding work, and I know you definitely had worked at other places, but I know COVID got your wheels through the door.
Yes.
So if you want to touch a little bit on that, and then we can get to her question.
So I have worked before. I was a camp health director for a special needs camp out in Jersey. I stayed there for the summer, and then I left. I came back to work as a case manager. So I worked as a case manager for a little while. working with people with disabilities and working with the elderly population in their homes and having aides and nurses visiting them. And it was a very taxing job because I know what it is to be told, no, you can't get the services that you need because you don't qualify. And what that means to the disability community when they don't get those services. So to be a case manager on that end, it wasn't working for me. I didn't have the heart to keep telling people no. So I left case management and got into school nursing, where I love my kids, but I still always wanted to be at the bedside. I think that that's where my impact comes in. And during the pandemic that hit New York like a tidal wave, washing everything away, hospitals were clamoring for nurses, and I had the experience and I got in. So a little backstory on all of that, it took me 76 interviews, acute care, clinical interviews. So not all of the interviews that I went on, just 76 particularly to get to a bedside nursing position. I was refused jobs. I was told that I couldn't be on the floor, told that I wasn't going to be able to be there or work there full time, that I should look at other aspects of nursing. And coming from other aspects of nursing, I was like, nope, I don't want to go back. I want to go to the floor. The pandemic hit and they needed all hands on deck, and I wasn't in front of a nurse manager telling me, we don't think you can be on our floor. I was in front of HR, and HR is not going to turn you away. So I went to the floor. I was there during the highest peak that hit New York.
That is completely terrifying. So, Jacques, and please forgive me if I'm saying your name wrong. But she asked, I'm sure that where you work is not totally accessible. What is
Nope,
the main?
I already asked that.
Oh, did you? I'm sorry. Does your employer, did you ask that one?
No, I have not.
Does your employer have to pair you with another nurse for a part of your work, like maybe helping patients get into or out of bed? And more importantly, what are you teaching to the other nurses about alternative ways to practice nursing to overcome accessibility issues?
That's a good question.
Great
So
question.
I'm going to do that in 3 parts. So the first part about having to be paired with another nurse. No, I'm not paired with any other nurses. We have nursing assistants. Nursing assistants are there for a reason. They're the ones that are helping patients to get turned in bed. They're the ones that are helping patients to get up to go to the bathroom if they're ambulatory. And they're the ones that are helping PT and OT get a patient out of bed. Now, where I come in and all of that is if a patient needs to turn in bed, I help them turn in bed. If they're immobile, like on a vent, and they are not conscious, then it's always a 2-person lift. And I usually have the bed really high and use the sheet that's underneath them to pull towards me, and that person kind of pulls their butt to the other side. So it's an opposite effect to keep them turned. If it comes to lifting a patient up in bed, what we do is we Trendelenburg a bed. So the bed lays like this. We Trendelenburg so the bed goes this way. Your butt now is higher than your head, and we pull you up into the bed. You're not actually lifting physically the person. What you're doing is you're moving the sheets up. If at any point in time we need to change sheets, we just turn the patient back and forth. Nothing too strenuous. And I guess that kind of leads into how am I teaching other nurses to do things differently. That's exactly what I'm doing. Their body mechanics are different than mine. I don't have to worry about gravity. I'm not fighting gravity all day throughout my shift. I'm sitting down. They're standing. They're the ones that are hurting. I'm the one that's like, I'm on wheels all day anyway. So, hey, let me show you my technique to getting this patient up in the bed. And now they're not having as much back pain anymore because I'm telling them to lift that bed as high as it goes and Trendelenburg the patient and pull them up instead of physically lifting weight up into a bed. It doesn't make sense. So, all the tips and tricks of the trade.
I have a question for you.
What's up?
So you said 76 interviews?
76 interviews.
How did you stay motivated and sane after the 10th, 20th, 30th, 40th, 50th, 60th interview. How did you keep that, motivation to keep going and say, something, I'm going to get this, and not throw in the towel and say, I'm not going to be a nurse. I'm going to try something else.
I ask myself that every day. One, I'm a faithful person. So obviously that's at the forefront of my mindset, is that I was put in this position and I wasn't brought to the table to be taken away. So that was just one mindset that I had to have. Like I wasn't brought this far to not keep going. I think that when you are met with a challenge, you either rise or you sink, and you have to decide that you're going to rise to the challenge. So it had to really be a mental component to me saying that I'm going to keep going. Was it hard? Extremely hard. I cried. I vented. I reached out to every resource that I can possibly reach out to. And then when I really got to the point where I felt defeated, I went on social media and I started to tell my story. And then I realized that other people were also feeling that way, are also being dismissed from nursing schools or not getting into medical schools because of their disability. And when you start to hear other people's stories and you realize, well, I don't want to be the failure. I don't want to be seen as the failure. I don't want to be seen as the person that gave up. You keep pushing. You keep pushing and you keep pushing. And even if you say no, then I just went to social media and said, I got another no. And then you get this whole wave of love that comes back saying we're with you and we're supporting you, and that grows.
Two things. One, I think, like, I just see you like rolling around, and I'm kind of thinking about just Jackie's questions, and I'm thinking about, not only is it about, your colleagues and stuff that you're showing what you can and do it, but it's also like the people who, like what I was saying earlier, going back into the hospital and seeing you. Like, I spent a lot of the time in the hospital, and I would have loved to have seen one who looked like me rolling around the clinic floor. Like, I would have just been so happy. And then it's just like, I don't want to use this word, but it's like, you definitely look like one of me. So I feel connected and I feel safer and I feel like I'm going to be heard. So like that impact that you're not only going to have with them, but you have it with the patients is incredible.
Oh, 110%. During COVID, I had a patient come in who was a paraplegic. He used a motorized wheelchair and he was brought to the floor, and he automatically, you heard him from the room saying, please don't move my wheelchair. Please don't, do this. Please tag this so I don't lose this, please. And he wasn't my patient. He wasn't assigned to me at first, but his neighbor was assigned to me, and I went into the room. And as I went into the room, he was like, "You're my nurse?" And I was like, "Oh, no, I'm not your nurse tonight. I'm sorry. I'm with this guy." And he was like, "Oh." And I was like, "Why? What's up? What can I do for you?" And he was like, "Oh no, I thought you were my nurse, but you are amazing. I think this is awesome." And I was like, "Thank you." Usually at work, I don't divulge into too much, just because I don't want to play into anything that patient may be going through, and then that kind of disrupts the night. But when I heard him complaining that he didn't want his chair out the door, what I did was just went and told the nurse, make sure that it's tagged. I put a big paper on it that says patient, and I put the room numbers, belongings, don't move from the outside. Every time that I went into the room, I was like, it's still there, I promise. And that just kind of gives him an alleviation to know that his belongings are still where we said it was. When you're an able-bodied nurse, you're not thinking about that. You're saying, okay, I just put it there and it's there. Like, don't worry about it. But when your legs are not near you and you don't see them, and that's your mode of transportation and that's what you depend on to get around, it's comforting to know that your belongings are where they say they put it. And I knew that. And I was just, every time I went in the room, even if you're not my patient, oh, I still saw it. It's out there. Don't worry. I'll move it back for you when it's needed. Or what can I get you? Do you need something closer to your hand reach, being that you are not in your chair and you can't get it yourself? Right? Like, making sure that before I even left, you don't have to be my patient, but making sure before I left, you're set for the night or set for the day.
That's a very scary situation, like not to have your legs, there, especially when you're not ambulatory at all. That anxiety-inducing feeling is crazy. You were just talking and you made me think about like when you and I first started speaking, like closely, it was in a hospital.
Yes.
And I think that's something we should touch on really quickly, just because I'm feeling nostalgic. But there's a connection there. But with social media, we had crossed paths, you know, for a couple of years, and then we were on social media together, and I saw one day she randomly posted she needed earbuds, and I was like, well, they won't be the most expensive in the world, but I can bring you something, because I knew that feeling of being she was in the hospital, and I know that feeling of being in the hospital and not having, you know, and it was Bellevue. The technology at the time, I don't know about now, but it was terrible. And I was like, I'm gonna bring this girl some headphones, and I brought headphones, and then the next day it was nail polish, and the next day we just evolved. But that comfort of I live so close to it, and I can help it's that relatable feeling of, you know, being with somebody.
Oh yeah, definitely. You got me through one of the toughest months I've ever spent in a hospital system in my entire life. And
Now they're BFFs.
I
So I wanted to give Jacques an opportunity to ask this question. We're butchering his name, so I'm just gonna mute him so he can say it.
Yes, please.
My name is Jacques.
Jacques.
Sorry.
Hi, Jose. That's okay.
That's what I figured.
I've heard much worse. I used to live in New York, and people thought my name must be, well, it's not English, it must be Spanish, so I would say Jacques, Jacques. Anyway, it's Jacques. And the question I had was, with all those tips and tricks that you have developed yourself to assist with your nursing practice, is any of this stuff filtering back to nursing school to teach nurses new and easier ways to do their job?
Not as yet. No, this has not transcended back to any nursing program as of yet. But that's because of the fact that nursing schools are still dismissing students with disabilities. They're not allowing students with disabilities, one, to get into the program, two, to stay in the program if they become disabled while in the program, or if they acquire a disability while they're in a program, they're not coming back to the program. A lot of people don't even see themselves as nurses once something has happened, so therefore they are automatically dismissing themselves. So as I'm growing a social media platform and a following with other clinicians, it has been something that I've been trying to get across, that what you determine as a physical requirement is not the physical requirement of someone who is differently abled, because what we face on a daily basis is going to be completely different than someone who's walking around and doesn't have a physical disability. So I think that there needs to be a complete education revamp on that end, especially in medical school and nursing schools. I just don't have the power to do that yet, and me do that alone. There are organizations that are out there, like the National Organization for Nurses with Disabilities, but they don't have the manpower either to be able to get tips and tricks and things into the nursing programs, and then hoping that the nursing programs will be accepting of that, because a lot of nurses are very one-track mind, right? Because nursing is a one-track profession. That's how it's being seen, versus being seen as a profession that is continuously developing.
I have a question. And then Carmelo, I'm sorry I jumped to Carmelo, but if you can work in any hospital, anywhere, wherever you wanted to work and do your nursing, where would that be?
Hawaii.
California.
I have a deep love affair for the West, but if I really had to pick a place here in New York, if it needed to be, can I pick two? Okay, so I was a patient at NYU Rusk Institute. That was where I did my rehab for 6.5 months when I was first diagnosed with transverse myelitis. So I would love to go back and be their success story. Like, here you are, someone that came in as a child and did 33 surgeries with us and has come back to now help help, right, and be a part of the NYU Medical Langone team. I would love that. That's always been the dream position. I want to be a pediatric nurse there. I wish. And on the flip side of that, Mount Sinai has played a huge part in my adult life. It's played a huge role in the spinal cord injury awareness that they're doing, their rehab floor, the people that I've met that are connected through Mount Sinai, and the doctors especially. Who wouldn't want to be a part of that team as well, especially the team that is ensuring that people with spinal cord injury, illnesses, and other disabilities are getting what they need when they need it, right? And creating a team for that particular population here in New York. So any one of those facilities would be amazing to work for.
So Carmelo has a question for you.
Yes.
Well, you know something, I'm going to talk a little bit because I agree with you with the Mount Sinai. They have the model system, and I was injured, going on 25 years in a couple days. And when I initially got injured, I went to Mount Sinai for rehab, and that has been my beacon of light. Whenever I feel down, they've always been my light. I wouldn't be in the position where I'm at now at United Spinal Association if it wasn't for my teachings and my light at Mount Sinai, because I keep reaching back to them in my darkest days. And I continue to mentor people, even through COVID-19. I've gotten on Zoom calls with people, you know, to continue to, preach and make sure that they get their voices heard and get to speak to someone just like them. But I digress.
No, but I think you make a valid point. Like Drea being a part of that scene would be amazing because, just to see, like you speaking to them is you not trying to lessen it, but it's someone like who became newly injured is now seeing Drea taking care of him. Like they'll get to see where they can be
Firsthand.
Yeah. Like, I maybe she was at one point where I am now, but now look where she is. Like, that's just so reassuring and uplifting. Not to say that what you do is not. That's not what I'm saying. But
There's this automatic sense of empathy and understanding when I roll into a room, whether it's with a patient that already has a physical disability or just a patient because their health is at a low point and they're having a rough point in their life. They know automatically when I roll into that room that I understand what it is to be in that bed. They know that I automatically understand the pain, the guilt, the self-hate that comes, the depression. I automatically get it. I know it. So they don't have to question whether or not I understand what it is to be in that bed. You're no longer questioning whether or not do I understand your position in that moment. I get it. If you're in pain, I hear you. I don't need to question how much pain you're in. I hear you're in pain. Even if you look like you're happy-go-lucky, I know you're in pain, right? Especially when nurses themselves will look and be like, well, you're laughing. You can't be in that much pain. The way we interpret pain for our bodies is completely different. So how great is it to have a nurse that will automatically understand that? I don't need to question it. It's what I'm taking it at face value. Whatever you tell me it is, that's what it is, right? You're already going to have a nurse that is 100% an advocate because she had to advocate to be at that bedside with you. Yep. So now whatever you're telling her or whatever you're doing, she gets to relay that right back to the doctor, and she has a backbone to go back to that doctor and say, no, this needs to be checked right now. And if it's nothing, but if it's something, at least we caught it.
Yep. So I want to get back to Carmelo. I didn't want to make sure we didn't forget you. Carmelo asked, Andrea, do you see nurses being sensitive to people who have CP and speech impediments? Because when he goes to the hospital, they think he's slow.
I haven't firsthand seen it because, again, my position was fairly new and it was through COVID. So a lot of my patients were not speaking as it was because it was hard for them to breathe. They weren't trying to speak long sentences. They rather write it down if they could, because it was too much for them to have to breathe and talk. So, but I can tell you firsthand, outside of my own professional experience, that I have seen people become very impatient with someone who has a speech impediment, or even the patient feel like they aren't able to articulate what they need to articulate, and then they feel like they're taking up too much time to get across what they need to get across, so therefore they hold back and they just give a little snippet. If they can get that snippet apart, they're happy. I don't settle for that. I will give you all the time that you need to get it done. If you want to write it down, if you want to text it, do it, because that's what you need to get across to me, and I'm your provider in that moment. I need to be able to go back to the doctor and say, no, this is the whole scope. I'm not going to lose my patience with that. I think there needs to be an understanding that with a speech impediment or CP or anything going on, that there needs to be time allotted. And I don't care about the dollar bill sign on that time. The time is going to be that person's health and longevity in the long run.
Yeah, you
No.
definitely don't want to miscommunicate some things. You want to give them the time to communicate what they're feeling so that you can appropriately treat what they are saying.
Exactly.
Carmelo, my mom has CP and she has a severe speech impediment as well. And I go with her, whether it be to the emergency room or to doctor's appointments. And not because I have to, obviously, but I want to, because my mom has come home so many times upset because she's not getting her point across. And even when I'm there, like, I'll go into the room with her and I'll say, oh, sorry, Stephanie, I'm going somewhere. I will go into the room with her, and the first thing I say is, my mom has a speech impediment. Let her take her time, and she'll say whatever it is she needs to say. Don't cut her off. Just let her speak. And even then, sometimes because here, I don't know about other places, but we have that 15-minute with a patient rule in visits, and they'll be impatient or pressed for time. And I'm like, no, my mom is talking. And when they put that pressure on her, it makes it worse. But anyway, so I say that to say that I completely understand what you're saying.
And I've been in meetings with Carmelo, and Carmelo, he will have his word in no matter how long it takes, and he will fight for it.
Yeah,
So.
right.
There's that. But that's the point. This is your health. And when it comes to the healthcare field, you deserve it. You deserve to be heard. You deserve to have your issues listened to. And then you deserve to have whatever it is treated in a manner that is efficient for you. Healthcare is not a one-stop shop, as much as they love to put us through this textbook, let's roll through the door situation. When you have a disability, you have no choice but to be your own advocate. And if doctors and nurses don't like it, find another one, because you know what? Your health is more important. And if you feel like you've exhausted those options, go to social media, because there's going to be other people that are right there with you.
Do you want to open the floor to people who aren't visible to ask questions?
Are there any other questions? We have 15 minutes. I know we have a comment from Jacques. He says, I too was at Mount Sinai. I helped mentor a few newly injured people some of them were so depressed because they thought their lives had ended. Having somebody like you, Andrea, in rehab would give us all a much more positive outlook on what the future could bring. So it's absolutely.
I think that's extremely impactful to hear. I think when we are considering representation in our community and what that looks like in the world, we don't see ourselves. And a lot of what I realized when I was a school nurse, a lot of what children even associate with disabilities is death, because they're first exposed to it with a grandparent, right? A grandparent might be the ones using their wheelchairs. A grandparent might be the one that is fragile and unable to do the everyday events of life normally, that they want to be able to do, right? So a child is going to associate physical ailment with a grandparent, and then what does a grandparent do overall is pass away over time. So if that's what they're experiencing as a child, and now for me to be a school nurse and they're taking care of them, I've heard comments like, oh, you can't take care of me, or you're in a chair, how can you do it? My grandfather's in a chair, he can't do this. And it becomes an education turning point. Now those kids grow up and become adults and have the same recollection of dealing with people with disabilities, and it becomes the death sentence, right? Now you're dealing with what they've thought as a child. Now they're dealing with, the grandparents who used to use those devices, and they're seeing younger people using it. So now they're thinking death sentence, God forbid it happens to them, and they're in that bed. It's now their death sentence. Nothing's going to happen. Life ends, right? They're not seeing the lawyers, the doctors, the nurses, the teachers that look like them. You're not seeing the stroke victims on commercials representing at Target, right? You're not seeing your representation out in the world. So therefore you are the death sentence. Whereas you see me now rolling in the room and you question, wait, can she do it? Yes, I can do it. I can do it quite well, actually. And I can actually probably do it better than a lot of other people because I understand your plight. And I'm also here to let you know that once you leave this room, that life happens outside that door and you don't get to stay home anymore.
Cool. I'm going to unmute the people who are on the phone. If you have any questions, please feel free to ask Andrea. So the people on the phone are muted. Do you guys have any questions for Andrea? Seems like we have a no.
No? Okay, guys, that's okay. No worries.
So we have 10 minutes.
I have a comment.
Yeah.
All right.
Andrea, this is Monica. Congratulations. I'm so very proud of you. I think you're a very good advocate for people with disabilities. And I just want to wish you every success and continue to blaze the trail.
Oh, thank you so much, Monica. I really do appreciate that. And I promise I'm going to keep the path and hopefully open the door for others.
Thank you very much. Good.
So if there aren't any other questions, I have one final question. And it would be, what advice do you have for others with disabilities who believe they can't do something or they're told that they can't do something?
Be the innovator. Understand that your passion is going to drive you wherever you want to go. That's what I had to use in order to get where I am. It's what a lot of people have had to use to get where they are. And if you are going to settle with a no, then you weren't passionate about it. Because if you're passionate, you're not going to settle on a no. You're going to find a way, whether it's you building your own way or it's you taking 76 interviews to get to where you want to be, even in a pandemic.
We have one more question. I'm sorry. It said final question, but
I have a comment.
well,
This is Sandrina from BCID.
Yep.
Sorry, I'm in red, but technical difficulties with my camera. But bravo and congrats to you, Andrea,
Thank you.
for really pursuing. And I'm happy to participate and hear from you today. Keep up the good work.
Thank you
For
so
people with disabilities. Oh, yes, so proud of you.
Thank you. I appreciate that. I love getting the words of encouragement, because if you think about it, when you face so many obstacles, it's like I told you, it's not easy. 76 interviews, and I told you I've cried and I've hollered and I've reached out. And when you know that you start to get to a turning point is when your own community can say thank you. And when your own community can say, keep going because we're right there with you and we're behind you. So now you know that I'm on the right path. So thank you.
you go, girl. So yeah, How about this? The final question.
Are you sure? We might be on like final.
It might be another final. How do you see your career path going forward?
Right now, I'm just trying to make sure that I secure a full-time position. I was a contract nurse for COVID, so it wasn't a full-time position. My contract has since been ending. It's not supposed to end until July 31st, but because census for COVID has been so low, I have not been getting any work. So my contract is now on termination soon, and trying to negotiate through all of that. But in the interim of that, I'm applying to other places and trying to find a job for a more permanent position. And within that, I do hope to long-term become a doctorate of nursing practice. And I say that because then that will give me NP status at the doctoral level. And then I can be a beacon for people with disabilities across the nation who need medical advice. And that's what the long-term goal is, to be able to have people with disabilities have one person that understands what it is that they need, or will try to understand to the best of my own ability, and connect them with providers that can help them. So that's the long-term goal.
All right, cool. That's great. Jessica, anything else you wanted to add?
I was looking just now for something Andrea said in the very beginning, and I don't see it. Of course, I should have looked at it before. But you said something in a post that was so powerful about something about being unwanted before, but now you're the essential. Can you like end with that?
Okay, so I will read you the post because I know it.
Yes.
Jessica knows firsthand that my ability to speak is way better 90% of the time, and I usually make her write down everything that I say because I'm not the best at it, but I never really remember all the time. So the post goes, I'll read you the whole post so that you guys know what the context was. It says, "Who would have thought every no that I would have faced turned into 'we need you'? Applying to endless positions, countless denials due to uncharted territory, comments like infection risk, incapable, and biases were hard messages to swallow. I always believed that I had a place among the floor nurses, even when I was told to move on to other facets of nursing. The bedside called me. The last few weeks have been a whirlwind. My knowledge and life experiences are proven to have given me a leg up among the seasoned. I'm here doing the impossible during the unprecedented. I'm the unwanted that became a necessity." So
Just like, boom, in your face,
That was excellent. Great.
right?
Oh, well, powerful. So,
Powerful force. Hey, Drea, other folks have asked for your contact information. So what is the best way to do that?
So you guys can definitely email. I'll write it here in the chat box for you guys. For those of you who are on the phone, it is A as in apple, Dalzell, my last name, which is DALZELL at iCloud.com. And if you guys are on social media, you guys can find me on Facebook at Andrea Dalzell. I do pop up my public pages there for everyone. And on Instagram, I'm known as the Seated Nurse. The THE Seated SEATED Nurse NURSE.
can you just put it into the chat? If you could just type it into the chat, and it'd be easier for people to come.
You did already.
Oh, it just came up.
Well, I want to give Rama a shout out. She says she's 12 with CP, and she wants to contact you. So, Rama, there it goes. I'll leave this up for 2 seconds so you guys can go ahead and take her information down, or you guys can email.
Or if you guys are in contact with Jessica or Jose, they'll
Yep.
put you in contact with me.
Yep. And I put my email and Jose.
Or if you
Sorry.
reach out to United Spinal or BCID, all of them know how to get in touch with me. These organizations know how to find me, so don't feel like I'm lost. Even if you Google seated nurse, I will come up, I promise you. So don't think that I'm ever too far away.
And if anybody wants a copy of the recording, let me and Jose know. Andrea, thank you so much for doing this and for all that you do.
Thank you. Thank you for having me, guys.
Thank you.
For
Thank
allowing
you.
me to be part of the conversation.
Yeah, and thanks for
All right.
everybody for being here, and thank you, Stephanie, for signing. Be well and be safe.
Bye, everyone.
Bye-bye.